Yeah, I will do that. I will. No problem, प्रिया। आप है ना अपडेटेड मुझे मैसेज कर दो। एक्चुअली डॉक्टर इज वेटिंग फॉर मी, सो मैं आप मैसेज कर दीजिए, मैं बाद में पढ़ के आई विल डू द नेक्स्ट फुट। या सी यू देन। या आई विल डू दैट। या थैंक्स।
You are not audible. I am not able to hear you.
Hello. Am I
Hello.
audible? Am
Hello.
I am I audible now?
Hello, sir. Good evening. You are audible.
Great. And
I am
can
not
you?
audible. Now I am audible. Now you are audible.
Thank you. Thank you. Friends, I'm just waiting for Dr. Tanisha to join. Yes, yes, just join now. Dr. Tanik, I would like you to unmute yourself let's talk briefly and then we'll start the session, live session.
Hi, good afternoon, Shrenik bhai, and good afternoon to
Good
everyone.
afternoon. Good.
So I'm Dr. Tanay Shah. Yeah, Dr.
Tanebe,
Tanay Shah.
give me
And, uh,
give me a minute. Let me give your introduction, and then I will allow you to speak, and will allow you to give presentation as well. Yeah.
okay,
Good afternoon, friends. I'm Shrenik from Ahmedabad, patient ambassador of Indian Cancer Society, Delhi, and today is my 51st. Today is my 51st live webinar I am hosting, and before I introduce the expert guest speaker, Dr. Tanisha, I would like to express my deepest gratitude to our collaborators, Professor Shirin Memon, Dr. Sneha, and Dr. Bhavna from Department of Science, Institute of Home Economics, University of Delhi. Uh, I express my deepest gratitude to all three academicians, being a part of this today's session. Now, I would like to introduce our today's guest speaker, Dr. Tanisha. Is a dear friend of mine, and I know him for at least more than 12, 13 years, and is a very eminent breast cancer surgeon at SCG at the Cancer Center. And one more thing, his wife, Dr. Purvasha, she is also a physician. So today, Dr. Tanisha is going to talk about a very important aspect that is about breast cancer treatment protocols and cosmetology and stuffs like this. So over to you, Dr. Tanisha, and Sneha, please allow screen sharing to Dr. Tanay. Thank you.
am I audible?
Yes, you are.
Yes, you are.
Okay. Hi. Good afternoon, everybody. So right now I am connected through my phone. Just give me a second. I'm trying to connect my laptop so that I can share my screen. Just give me a minute. So sorry for the delay. I just came from OT right now, so just give me a couple of minutes.
Friends, actually, as a matter of fact, Dr. Tanay called me up in the morning and he said today being Friday, he's having back-to-back 10 cancer surgeries. And he said, allow me to come at least 15 minutes or half an hour later. I said, I cannot change the time because too many commendable individuals are going to join today's session, and I respect their time, so that's how he could manage to come early. Thank you, Dr. Tanay, for joining on time.
So now I am on through my laptop. So you may be seeing like couple of IDs of mine, and if you can allow screen sharing.
Okay, sir.
Yeah,
Just give
it
me.
is already allowed.
Yeah. Okay, fine. So I am disconnecting this one, and then I'll be on through my laptop.
Super. Friends, today Dr. Tanay is going to talk about the session and everything about breast cancer. and everything. And then, later on we will open the platform for Q&A. Good evening, Jyotna madam. Thank you so much for joining. Glad to see you. I'm Priya. How are you? And Dr. Paula Sharma, thank you so much for joining. Dr. Shrenik, Maman,
Thank you, Shrenik, sir.
and of course Dr. Sneha as well. તને ભાઈ તમારો લેપટોપ જરા સેટ કરવું પડશે. I mean laptop no screen.
Yeah,
Yeah, this is better
fine.
now.
તો નીરવ આ સ્ક્રીન કરી દે તો ચલ જલ્દી નીરવ આ સ્ક્રીન કરી દે ચલ આ થઈ ગયું કનેક્ટ હવે આ સ્ક્રીન શેર કરી દે સ્ક્રીન okay, now you can see that.
Not yet.
Yeah.
Yeah, now
It
we
is
can see
there,
this. Yes.
right?
Yeah,
Okay,
yeah,
fine.
that's right.
So, good afternoon, everybody. Sorry for a little delay. So, breast cancer being a very important topic, and we know that it is very common nowadays. The worldwide incidence says that it is as common as 1 in 10 females in her lifetime is going to suffer from this breast cancer. Fortunately, we do not see cases as seen in this photograph in recent days because of the awareness and podcasts like this, and thanks to uh, great people like Shrenik Bhai who keep on, you know, engaging into these sort of awareness talks and all, so that people they do come to us early. And as I have rightly written over here, that this beast can be bitten if it is tackled timely. So without wasting time, I'll go through the presentation. Uh, so this is the data. This Globocan is the Indian data. So here it says that in 2022, it updates its data every 4 years. So now 26 will have new numbers, but in 2022, almost like 1.4 million, that is 14 lakh 13,000 new cases of cancer were diagnosed in India, out of which more than 50% of the patients they died. And 5 year prevalence, if we see, it is like 32 lakhs 58,000. So this is how much the burden of cancer is there in our country. If we see this slide, so the top five common cancers in both the sexes. In males, we have lip, oral cavity, and the throat cancers as the common cancers, the head and neck ones. In females, breast cancer is the most common cancer. But the interesting one is the last part. Even if we combine both the genders, breast cancer is still the leading cause of cancer in in entire Indian population. Being a female dominated cancer, it is still the most common cancer in India, accounting for almost like 13.6% of all cancers across the country. So this is the worldwide data. So it says that in 22, 2.3 million women were diagnosed with breast cancer, and approximately 13.1% of these women diagnosed with breast cancer at some point in their lifetime will be diagnosed by breast cancer. So out of total population, we have like 13.1% incidence worldwide, and it accounts for 15.4% of cancer related female deaths way back 4 years ago. Now the data, once we have the new data, we may see that this number might have gone up also. So, 1 in 8 to 10 females is going to develop breast cancer as per the current incidence of the cancer. And it is not likely that males cannot develop breast cancer. Males also, they do have rudimentary breast gland. So, our data says that for every 138 female breast cancers, we can have one male breast cancer also. And we ourselves at HCG, we have a paper published on male breast cancer. So in 4 years' time, we had operated almost like 30 male breast cancer patients. That paper is also there in a reputed journal. Uh, so India is probably the third in breast cancer annual incidence if we see worldwide. In India, for every two women newly diagnosed with breast cancer, one will die. So mortality of breast cancer in our country is around 50%, which is way too high compared to global standards. So, but things are looking up. So death rates from breast cancer, they have been declining since 1990 because mainly due to screening and early detection. With programs like this, we keep on creating awareness and, uh, motivate more and more females to participate in breast cancer screening programs. And the treatment options over these last 25-30 years have improved to a great extent. So today, the research is such that every 6 months we have a new molecule, a new drug coming up for the treatment of breast cancer. So in today's era, despite of being detected in later stages, we can still provide a good longevity as well as good quality of life to our patients. Now we'll talk about some things to watch out for as a common person, what we should be careful about. So, breast cancer usually starts as a painless lump in the breast. So, we always say in all our awareness talks that any lump in the breast, if it is not causing pain, then it is more suspicious in terms of being a cancer. Something which is very painful to begin with, it is very less likely to be because of breast cancer origin. Apart from a lump, one can notice change in the size and shape of both the breast, or one breast keeps on enlarging and there is some asymmetry between shapes of both the breasts. So that can also be a sign of underlying breast cancer. Along with breast lump, one can have swelling in the underarms. So that can be an enlarged lymph node. So that also is a sign of breast cancer. Sometimes if we see a bloody nipple discharge, so that also can be a sign of underlying breast cancer. Breast pain is rarely a symptom of breast cancer unless and until the lump grows to such a big size that it involves the overlying skin or the underlying chest wall. Then breast pain can also be a symptom. Apart from this, there is a very rare but aggressive where the breast cancer might be present without an underlying lump also. In that case, the entire breast skin gets swollen. It looks like an orange peel. So, and then you may not be able to palpate any lump underneath, but then it feels something like an orange peel, becomes thick, red, and pitted. And if we compare the temperature of the skin on both the breasts, then the affected side might feel warmer. So that is also a sign of a very aggressive variant of breast cancer, which is known as inflammatory breast cancer. So if somebody has like these sort of symptoms, then it should be reported to your clinician as early as possible. Now we'll talk something about screening. So the basic meaning of screening is if we can pick up the disease earlier than it manifests clinically, earlier than the symptoms are there, then we can pick it up in a very early stage and we can provide a sure shot treatment, and a very minimum treatment is required for almost 100% cure. So, how do we do screening in breast cancer? So, there are various aspects. One is breast self examination, another is clinical breast examination, another is mammography, sonography, and in some cases, one can go ahead with MRI of breast as well. So, coming to breast self examination, so we at our hospital we have dedicated nurses who teach our patients as well as their relatives about how to do breast self examination. So it can be done at the time of bathing or in front of the mirror, and to be done in all the positions by like arms by the side, arms over the head, and arms on the hips. So, what is to be looked for? So, any painless lump again in breast or in the armpits, or any change in breast size or shape. Something like this, the affected nipple might be retracted inwards, or there may be blood-stained discharge from the nipple, or in some cases, there might be some ulceration over the nipple also. So, these all are the signs of underlying breast cancer, which one can easily look for in breast self-examination. Apart from that, if there is some dimpling on the skin or skin appears puckered or looks like an orange peel, so that can also be a sign of it. When to do breast self-examination for a premenopausal lady, it should be done after 3 to 5 days of the bleeding period is over. For postmenopausal lady, it can be done on any fixed date of a month. So that is how we should do it. And one should use the palmar aspect of the fingers in the rolling motion over the breast so that nothing is missed. And if you do a proper breast self examination, any lump which is like more than 1.5 to 2 centimeter in size can be easily picked up by the patient herself. So it is quite easy to be done once in a month. And if one notices anything suspicious, as I discussed in the previous slide, one should go and contact the clinician. So the other part is clinical breast examination. So that is to be done by the doctor. We usually advise all the ladies above 40 years of age, irrespective of whether they do have any family history of cancer or not, to come for annual breast examination. So that is to be done once in a year. Somebody who's aging between 20 to 40 and has family history, so they can come at every 2 to 3 yearly interval for breast to be examined by the doctor. Coming to mammography, mammography is nothing but a specialized X-ray of the breast. Uh, it is taken usually from several angles, but in clinical practice, only two angles are important. Hardly takes around 10 minutes time, and some it involves some compression of the breast tissue between the two X-ray plates. And there is a common myth that it is a very painful procedure, but it is actually not a painful procedure. But it is very useful, at least for ladies aging more than 40 years. They should come for mammography at least once in a year, and then if that is not possible, at least once in couple of years one should get an mammogram done. Although it is not 100% accurate, but the accuracy is more than 90-92%. And once the age advances, the fat component in the breast increases, then the accuracy also increases. So I won't go into the details of this thing. Various screening agencies, they recommend that all the females aging above 40 years should undergo mammography every year. In India, we do not have a mandatory screening program, but we usually encourage through these kind of programs and all that please motivate all your female relatives who are aging more than 40 years to get a mammogram every yearly, even though they do not have any complaints pertaining to their breast. Uh, Ultrasound, that is the sonography of the breast. It's a very common OPD based procedure, completely non invasive. So, every time mammography is also done in conjunction with ultrasound. So, it is also very useful, can characterize almost all breast lesions, whether they are benign or malignant. And the benefit of doing an ultrasound is whenever you have a suspicious lesion, your radiologist can at the very same time do a biopsy under local anesthesia under ultrasound guidance. So this is also a very useful tool in terms of breast cancer screening. So this is how we do the biopsy. It's a very simple OPD based procedure. So that is whenever there is some categorization in mammography and ultrasound report. So if it is like beyond certain category, then that particular mass or the lesion, it needs to be biopsied. It's a very simple procedure to be done under local anesthesia using a needle without putting any incision on the breast. the biopsy can be taken very easily. Uh, so there are certain breast cancer related myths. One myth is like only women with a family history of breast cancer they are at risk. So it is not so. Yes, definitely. Somebody who has had a family history of breast cancer, ovarian cancer, or certain types of intestinal cancer, they are at an increased risk of developing breast cancer. But it is not so that people not having family history of breast cancer, they are completely risk free. Almost 70 to 80% women diagnosed with breast cancer, they have no identifiable risk factors. Another myth is it is non-curable cancer. So 90% of the early stage breast cancers are completely curable, often without needing a complete breast removal. Even with breast conserving surgery, we can completely cure it. Even though patient present, some of the patients they do present in locally advanced or very advanced stages. So even though we cannot cure them completely, but the treatment and the research updates are such that we can control their disease for a very long period of time, and at the same time patients quality of life can also be maintained very well. Another myth is only women can get breast cancer. This I have clarified in my earlier slides. Then another myth is it always comes in the form of a lump. It usually does come in the form of a lump, but it might not also. The one which I told you about was the inflammatory breast cancer. So there can be only skin changes. The skin becomes red, hot, tender, and uh, it can appear as an orange peel. So that can also be a sign of breast cancer. Another common myth is that annual mammograms expose you to so much of radiation that in itself it will increase your risk of breast cancer. So this is completely a myth. Probably uh, it was popularized in one of the Swiss articles, but then their government and health department also denied the fact. So doing a yearly mammography after 40 years will not pose you at an increased risk of radiation associated cancer. So this was my message, and there is a small another presentation if time permits, Shrenik bhai. So there are certain other myths about which patients they do come in our OPDs and they tell us that this is not to be done. So I just want to clear the noise about it. So there are like types of biopsy. So in peripheral centers, they do something which is known as FNSE. But FNSE in today's era for breast cancer does not hold much of the value. So it is not as good as true cut biopsy in the diagnosis of breast cancer. So, the truth is, the true cut biopsy, that is the biopsy done with a slightly larger bore needle, the needle which is slightly thicker. So, that is always better because in FNSE, you get only the liquid component from the tumor, whereas in true cut biopsy, you get a core of the tumor without putting an incision. We can introduce a larger bore needle through skin itself without putting an incision under local anesthesia, and that will get a core of the tumor, and it has got better sensitivity, specificity, and it can differentiate between various types of breast cancer. So certain types of breast cancer are such that despite of being operable upfront, they warrant chemotherapy or some other form of systemic therapy to be given first. So it is always better to go for true cut biopsy and not FNSE. So if somebody advises that go for FNSE, so it is better to always undergo for true cut biopsy. So mammography is still a luxury, that is completely a myth. Mammography is very much essential for the workup of a breast lump. So it cannot be done that in peripheral centers, if you have a lump and then people will say that we'll do a lumpectomy first and then send this thing for biopsy, and whatever it turns out to be accordingly will manage further. So that is not to be entertained. Always consider doing a mammogram first if we have any sort of abnormality in the breast, and always these mammograms are done in conjunction with an ultrasound also, so that will clear the picture, and it is not always necessary to go for the complete removal of the lump in order to establish the diagnosis. So that is another myth. So excision biopsy is the go-to investigation. No, the true cut biopsy is as good as excision biopsy. So, in practical terms, if I tell you that somebody does a complete removal of the lump just for the sake of establishing the diagnosis, and then that patient comes to us. So, in cancer surgery, the principle is if we are excising the lump, then we have to get rid of that cancerous tissue with good, adequate negative margins all around the tumor. We should have the covering of a normal tissue all around the tumor. So, if the excision previously is done by somebody who has done it just for the sake of establishing the diagnosis, that person is not bothered about establishing negative margins. And when that lady comes to us, so somebody who's amenable to undergo a good breast conservation procedure just by undergoing this excision biopsy earlier on will end up undergoing mastectomy, because in that case we are not sure about the margins, so we cannot compromise the safety of that patient. So unnecessary patient will end up undergoing mastectomy. So that is not to be entertained. So if for any breast lump, if somebody tells you that we will remove it and send it for biopsy, no. True cut biopsy is as good as complete excision for the establishment of diagnosis. So always undergo true cut biopsy first. In today's era, the role of excision biopsy is when there is discordance between our clinical radiological findings and the biopsy findings. If clinically or radiologically I am suspecting that the underlying lump is cancerous, but my true cut biopsy says that it is not, then only it is an indication to excise the whole lump and send it for biopsy. But this rarely happens. The concordance between clinical radiological and the histological, that is the biopsy finding, is more than 95%. Uh, Another common myth which patients they routinely ask us for is, once the cancer diagnosis is established, patients will say that should I undergo PET scan? So no, PET scan is not mandatory in all the cases. It is mandatory whenever the tumor is very large, more than 5 centimeter, or whenever there is some sort of skin involvement, or there are big bulky nodes in the underarms or the axilla. So whenever locally the disease burden is too heavy or too high, then only I'm bothered about that whether the disease must have spread to the distant organs like lung, liver, or bone, something like that. In that case, it is mandatory to get a PET scan. But somebody who comes with a 2 centimeter size lump, overlying skin being completely normal, no axillary nodes, then there is no need to undergo PET scan in that case. Another is, if the patients they do want to avoid biopsy, so they'll always ask us that whether we can substitute it by doing a PET scan or not. So PET scan is not the investigation to establish the histological diagnosis of the cancer. It is for the purpose of staging. So once we know that cancer is there, and if we want to know that where else in the body it might have spread, for that purpose we can do PET scan, not for the establishment of diagnosis. So PET scan is not recommended in all the cases. So if your doctor says that PET scan is not required, so you might be having very early cancer for which PET scan is not mandatory. We can simply do a routine sonography of the abdomen to look for the liver thing, and we can do a simple chest X-ray to look for the lungs. Uh, Another myth is, whenever the patient comes with a diagnosis of breast cancer, the patient herself and few of the family members, and in today's era, some of the neighbors, they simply rush to us that surgery કરીને પહેલા કાઢી નાખો. So this is not the way to go. All the breast cancer, they are not the candidates for upfront surgery. That is why we do it something like this, where the skin is extensively involved. Although this disease is very much operable, we can do a good surgery and then discharge the patient on the very next day. But then this patient, as per our guidelines, is a candidate for chemo first, followed by surgery. And if we follow the correct sequence, it will have a lasting impact on the long-term survival data. If I operate this patient first, who requires chemotherapy from day one, then the essential part, that is chemotherapy, will be delayed for at least 4 weeks. So that is causing harm to the patient. So it might happen that you may be harboring a small lump or a completely surgically treatable lump, but your doctor says that you have to undergo chemo first. So there is some logic behind that. Guidelines also say that some of the aggressive cancer subtypes and some of the higher stages they require chemo first, followed by surgery. Uh, Very commonly asked question to us is why should we undergo a breast conservation procedure? આમની તો એજ 50 વર્ષથી વધારે છે, 60 વર્ષથી વધારે છે, just chop off the entire breast. No, it is not necessary to undergo mastectomy for each and every patient of breast cancer. If you have a very small tumor, a single tumor, so breast conservation is the way to go. It provides excellent results which are comparable to mastectomy. The only prerequisite is once you go a breast conservation procedure, the patient will need radiation later on. But doing radiation for breast cancer is very easy, not complicated at all, doesn't lead to any sort of side effects on rest of the body parts. The overlying skin will get slightly thickened, which will turn to near normal in around 3 to 4 months time. So for a smaller tumor, single tumor, it is always better to go for breast conservation. It is not going to harm you in terms of decreased survival. So the survival rates are comparable to whole breast removal, that is mastectomy. Uh, so this I'll not go into details. The BRCA mutation carriers, we must have heard that BRCA is something where one should undergo a bilateral mastectomy. So it's a hereditary breast cancer and a genetic one. So it is not necessary for all BRCA mutation carriers to undergo bilateral mastectomy. One can do breast conservation on the affected side, and the other breast we can keep that under observation by doing a regular follow-up. So we do 6 monthly mammograms and 6 monthly MRIs of the breast for BRCA mutation carriers, and still we can offer them a breast conservation without removal of the opposite normal breast. Uh, so mastectomy leaves a permanent scar of the body on the body and self-image. So in today's era, with good sort of reconstruction options available, it has become a myth. So best breast reconstruction, whether partial or the whole breast reconstruction, is no more a rarity, and we provide all sorts of breast reconstruction. So this is example of one of the ladies who had undergone a complete mastectomy, but we could preserve a lot of skin. And fortunately, this lady had a lot of fat on her belly, so which we could use in the form of a plastic surgical flap and reconstruct the entire breast for her. So you can see how the result is. So that would have boosted up her self-confidence to next level. So despite of suffering from breast cancer, her whole breast removal was warranted, but we could do that. Can you pick a couple of slides only?
Take your time.
Uh, Other examples like we can use silicone implants in today's era. So this lady had undergone surgery for bilateral breast removal because she had bilateral cancers. So we did silicone implants for her bilaterally. Uh, all breast cancer patients, they require chemotherapy. That also is a myth in today's era. So without understanding the types of the breast cancer, which are hormone receptor positive, whose growth is dependent on the estrogen hormone, and if they are very early stage, so there is a test by which we can determine whether these patients will do good without chemotherapy also. And we can simply offer them 5 years of anti-estrogen therapy in the form of an oral pill, which is practically free of any side effect. So that also is a possibility in around 10 to 15% of all breast cancer patients. So one of such tests is Kenasis. This is an Indian-based test. There are certain other tests from various other countries also. All breast cancer patients, they do not require radiation therapy, particularly if they are very small tumors. So and there is no spread in the axilla. We can still we do have the data that we can avoid radiation later on. So with this, I thank you all. you people have spared time on a Friday noon to hear me out. So thank you very much. Over to you, Shrenik bhai.
Thank you. Thank you, Dr. Tanisha, for explaining everything in a very flawless and fluid manner. And before I speak to you further, I would like to speak with the audience, particularly the female attendees. I just
Sure.
want to I just want to draw attention of everyone that we at India Cancer Society daily, we are bringing the best of the best cancer specialists or oncologists. And of late a lot is being talked about women empowerment on web social platforms, but to this live webinar we are bringing in the competent highly experienced Indian cancer surgeon, who are operating, and they are having, they are using more than 100 and 150 patients in their OPD every day. So their experience matters. And here again, the clear is very good. The guidance, the details with the slide, the experience, believe me, you will never be able to get it, simply by walking to any cancer specialist. And more, we are conducting such kind of live
Shrenik sir, your voice is breaking. Shrenik sir, can you hear me?
Sir, you can stop sharing the screen
Sure.
so that we can know.
Well, I'm sorry for the technical glitch. So this is what exactly we are doing it, and I would like to open the platform for questions from whoever is willing to ask. Thank you, Dr. Tanay, for your valued time and joining us on time despite of your series of surgeries right from morning till now.
No, no, it was my pleasure, Shrenik bhai.
Thank you. Uh, Priya Tiwari,
Hello?
I mean, Dr. Arunaji, if you might ask any question, please. And of course, our chairperson, George Govinji, George, uh, please unmute,
Yeah, I'm
unmute yourself.
muted now. Thank you, Dr. Tanmay. That was a very clear talk about breast cancer and the myths surrounding it. You touched very briefly on genetics and particularly on the BRCA gene. I was happy to hear that you actually try to preserve the other breast, and I hope also the ovaries and the uterus,
Yeah.
because
Yes.
sometimes I feel that the cure can be worse than the actual gene presence in the woman's body
Yes.
when they are almost castrated with the treatment. So, is this the new trend that is coming, that you try to preserve the other organs and only treat the affected breast?
So in terms of BRCA, there are like two genes, two variants of BRCA. One is BRCA1, another is BRCA2. So
Hmm.
BRCA1 is more dangerous. It affects you at an earlier age. So if one has like BRCA1 mutation, for breasts, we can still go ahead and observe very frequently. So for these ladies, those who have not undergone bilateral mastectomy, so what we suggest is they come to us, and every 6 monthly we do get a mammogram. After another 6 months, we get the MRI of the breast, which is a very sensitive investigation. Breast being a surface organ, anything suspicious, especially once it has occurred, so can be very easily picked up by the patient and definitely by the doctor. So for breast, it is not necessary for somebody who's BRCA1 to absolutely undergo mastectomy at the time of diagnosis of having BRCA1. But in terms of ovaries, the symptoms of ovarian cancer, they are very vague. So till very late stage, what all one can experience is a very vague type of abdominal pain, some bloating, some indigestion. Those are the earlier symptoms of ovarian cancer. So for somebody who's harboring BRCA1 mutation, we advise them that as soon as your family is completed, the number of desired children have born, after that you undergo a laparoscopic bilateral oophorectomies,
Hmm.
or at least once you have reached the age of 40, you should undergo oophorectomy for BRCA1. For BRCA2, the scenario is different. BRCA2 is known to lead to an increased incidence of ovarian cancer, but the age corresponds to the sporadic ovarian cancer age. So it will affect you in terms of ovarian cancer at around 60 years of age. So for BRCA2, the criteria are a bit liberal. So if you have BRCA2, one should undergo oophorectomy, but it is fine that even after achieving menopause, if the lady undergoes oophorectomy, that is okay.
We're not talking ovarian cancer because we all have a lot of doubts about the number of young women who are presenting nowadays with ovarian cancer.
Yeah. Even for breast cancer, the time I was studying, so the common age of occurrence was somewhere in the fifth decade, sixth decade. Now we are seeing females of early 30s, late 20s also coming up with breast cancer.
Yes.
So, uh, if I am allowed a minute, I can explain you why this has occurred.
Well, Shrenik, tell us, does the doctor have a minute? Go ahead, sir.
So, see, now we see the average age of marriage has gone from, I would say, 25 to 32 years, 33 years. It has become very common to get married at the age of 33. So, our data, our literature says that if you have your first pregnancy after 30 years of age, or if you do not conceive a baby, you are at an increased risk of developing breast cancer. If you do not breastfeed your baby or do not breastfeed your baby adequately, then also you are at an increased risk of breast cancer. So, with advanced age at marriage, you will have first babies coming at like 35, 36 years. A lot of issues, no breastfeeding, and all these have collectively contributed to increased incidence of breast cancer, particularly in young females in today's time.
Mm. Yeah. Is there anyone else who wants to ask? I
Uh,
heard a
so-
voice.
yeah. So I want to check up one thing. We normally say mammography every year or every 2 years or something. Unlike cervical cancer, where we stop doing the tests after the age of 70 or so, is there any upper age limit where one should stop getting in the mammography done?
So there are like various agencies who have come up with their own guidelines, but the ones which we commonly follow, it says that from 40 to 75 years, one should undergo an annual mammogram. Because by 75, if you do not develop breast cancer, then your risk of developing breast cancer after 75 is very sparse.
Okay. And only ultrasound will help at that time after 75?
It does, but then mind you, this mammography increasing the radiation exposure is completely a myth. There is no harm in undergoing an annual mammogram. If I tell you practically, some of our orthopedic colleagues during their during their teaching tenure, they undergo radiation exposure like 10 X-rays in a day. That is how their curriculum is lined up, and that is how the practice is going. But still, it is very safe. So I wouldn't say that one should undergo on a monthly or a daily basis, but yearly mammogram doesn't pose you at an increased risk.
Thank you.
Yeah.
Dr. Naruna, I would like to add one point here. Instead of inviting the problem, it is better that get the test are done. At least you will be fairly well checked out, and on top of that, you are having a mental stress whether I'm having this or not. That so when facilities are available, why don't we use it? Uh,
Shrenik
yeah,
sir, your
Diwali,
voice is
anyone
breaking.
else would draw questions? Because I mean, this is absolutely today's session is absolutely pertaining to the female community. So feel free to ask questions because you won't be getting such opportunity, during one-on-one consultation with because you'll be spending a lot of time and even doctors are having their own commitment priorities, so you may not be able to get a necessary advice when you're really needing it. Uh, Look at the budget time other individuals if they are willing to ask question. I would like to speak a little bit about cosmetology. I mean, which is the integral part of breast cancer surgery. So, if you can speak a bit about cosmetology on breast preservation and so on.
So, for almost like 50% of breast cancer patients, it is not necessary to remove the entire breast for that lady as part of the surgical cure of the disease. So, for 50% of them, we preserve their entire breast. In some of the cases, when the symmetry with the opposite breast is not matched, we can do a partial sort of reconstruction also, utilizing nearby fat as plastic surgical flaps. Sometimes, when a lady undergoes whole breast removal, then we have the options of whole breast reconstruction that can be done at the very same time by either utilizing the abdominal fat or sometimes the fat and muscle on the back. And sometimes we can use a combination of body's own fat along with an implant, or sometimes we can use the implant alone. So, in today's era, either partial or total breast reconstruction is very much possible at all tertiary care centers. So there is no need to be worried about. We do offer like primary reconstruction, that is along with the primary surgery itself, or a delayed reconstruction option. So for certain ladies, we ask them to wait for their completion of their entire treatment, and a year or two down the line, that also can be done.
Dr. Tanmay, if you will please excuse me, I need to join another meeting. The others are all there.
Okay.
Thank you.
Thank you, madam. Thank you for joining us today.
Pleasure.
Dr. Tanay, I believe there are no further questions from the audience and dear friends. Today's session will be easily available on YouTube channel of Indian Cancer Society. And Dr. Tanay, thank you so very much for your valued time, guidance, presentation, and flawless explanation. And on behalf of Indian Cancer Society, I express my deepest gratitude to Dr. Tanay Shah and Dr. Shirin Memon, Dr. Pauna, and Dr. Sneha for being a very commendable collaborator for us. So thank you so very much, everyone and all participants. And we look forward to your active presence into the 50 second live webinar that will be held on 24th of February. So thank you so very much, everyone. Have a great day and enjoy your weekend. Tanay, thank you so much for your valuable time.
Thank
And
you.
I would like to
Thank you,
invite.
Shrenik Bhai,
I
and
would like to
all the
invite.
members of Indian Cancer Society. Uh, yeah,
Thank you,
I'll
Dr.
take your
Tanay.
leave. So a couple of patients are waiting for me, so I'll take your leave. Bye.
Thank
Thank you,
you.
Dr.
Thank
Tanay. It
you.
was very informative.
Thank you.
Bye bye. Bye bye.